I'm Dr. Adam Brekke. I'm an adult reconstructive orthopedic surgeon, so I do hip and knee replacements here at Duke Health. My patients are adults with hip or knee pain, or sometimes both. Most often those are degenerative conditions of the joint, so it's arthritis. There are other inflammatory conditions as well, or even previous trauma that can affect the joint. I also treat patients who have already had a hip or knee replacement that still have pain or dysfunction and sometimes need another surgery. I specialize in an anterior-based muscle-sparing hip replacement, which is a certain way to do the hip replacement that avoids cutting some of the major muscles around the hip, and so I think it leads to more speedy and normal recovery. When I first meet you as a patient, one of the first things I'll ask you is, what activities are your favorite activities? What are your priorities? And then to follow up, how does your hip or knee impact your ability to do those things? And so once we determine what your priorities are, we have goals in mind. And all of our treatments are targeted at achieving those goals. I help guide you to a treatment that makes the most sense for you. It's not always surgery. Sometimes it's anti-inflammatory medications or specific exercises, and those are some of the long-term solutions. Every once in a while we can do injections, and that can make sense for some. When that doesn't work anymore, that's when we introduce surgery as an option, and that's hip or knee replacement. The most satisfying part of my job is how enthusiastic I get to be when we get to share in success. And so often it's high fives or hugs when after treatment patients can do the things they want to do again.